Roger Kincaid and Rob Breckenridge.
Kincaid and Breckenridge on News Talk 770. Thanks for being with us on this Monday. We will talk about public art coming up after 11 o'clock, another project in Calgary that's got people fired up, to say the least. We'll talk about the sewage shack. I'm just going to keep calling it that. What's it, $235,000?
Yeah, you know what?
For the public art?
I'm looking at, I need some clarity on that too, by the way. If the art component of this is $235,000 or if it's the whole unit, because it has like a purpose. This lift station does something, so I'm wondering if that's part of the cost of it.
Yes, I got a much better term, by the way, than sewage shack, but I can't use it on the air.
Is it made of bricks?
It's, well, shack, I'd still use the word shack.
Oh, I see.
I would just maybe use something else.
Yeah, I got to tell you something, by the way. Reading stories about municipal politics on the Calgary Sun website are not nearly as fun now that they've taken the comment section away. I mean, what's information without vitriol? That's what I ask you. That's what I ask you, Rob Breckenridge.
Something to ponder. You know, something we've talked a lot about on the program recently, because there's a lot been happening on this front, the whole realm of medical marijuana. The Supreme Court recently came down with a significant ruling about the kind of medical marijuana patients can access. The government's been bringing in changes in terms of how patients get this in the first place. So amid all that confusion, clinics like this next one have been springing up to fill that void, to try to steer patients, help patients get the help they need, get the expertise they need. But now I guess that's posing a dilemma for municipal regulators, because these have proven to be, well, as it turns out here in Calgary, incredibly popular.
Yeah, we talked about this in Vancouver with all the dispensaries that popped up, and the city just finally throwing their hands up and saying, well, we're going to just try and regulate these things. Well, now, you might remember this next guest. This is Jeff MOOJI from the 420 Clinic in Inglewood. Jeff, welcome back to the program.
Good morning.
So, Jeff, the last time we talked to you on Kincaid and Breckenridge, you were trying to set up shop. It was just sort of a glint in your eye, so to speak, and there was some people that were concerned about your presence in the neighborhood. But now you're wide open and business is booming, yeah?
Yeah, it's been great. We've been able to help lots of patients. It's been wonderful.
Okay, talk to us just a little bit about what your clinic is and what it does, because we had like the ideas conversation back then, but now we can be practical. You've actually been doing this.
Yeah, we like to call ourselves an alternative wellness center, but obviously focusing around medical marijuana. We basically help patients through the whole process of the MMPR and get licensed to be able to use medical marijuana for their ailments. We're kind of a one-stop shop we kind of look at. We have a registered massage therapist. We do classes, a variety of different things, but we really focus on the medical marijuana to helping patients.
And in terms of the void you fill, because, you know, we don't see these kinds of clinics that are specific to any other kind of medication. So what is it about navigating the medical system for patients who might require medicinal marijuana?
Well, Health Canada basically has set up a different system also with regards to this than any other drug. And it's also patient-driven like nothing we've ever seen before also. People are looking for more alternatives, especially people with cancer for sure, are looking to help with chemotherapy, et cetera. But it's patient-driven like nothing else. And, you know, we kind of fill a void. We're a value-added service for doctors who are willing to write the prescription or are unaware of the next step involved with licensed producers, the proper strains, proper dosage, all that kind of stuff. So we really are a value-added service to the doctors in Alberta.
Okay. How many, what do you say, patients or customers?
Patients, yeah.
Okay. How many patients have you got?
Well, it's growing daily. I'd say we're probably over 250 right now.
Wow, because you talked about starting with like a dozen or something like that when we talked about that.
Yeah, that was basically it. To be honest, it started exploding, and it continues to grow exponentially every month, which is great. When we first started out, I'd say we were getting about one prescription a week from a doctor in the city area, looking to support patients with this, separate from what we do. Now we receive at least 4 to 5 a day.
Okay. Now clear something up here, because your sign says this is not a dispensary. Like that's
correct. That was part of the regulations for my permit. I had to put that on all signage.
Yeah, because it looks like, I mean, the way it's positioned on your sign, it looks like it's the slogan for your operation, but it's...
Yeah.
So, but
in a way, it kind of is. I mean, we don't want to be the BC model. I don't want to see that coming out here.
Oh, okay, but people cannot get marijuana at your facility,
No.
at the 420 clinic. They simply
No.
go in there, learn what they want, and then you presumably connect them with people who
Correct.
have the product that they are looking for.
We're one of the only trusted resources in Canada for to feed also. So, I mean, we're here to help people, and no, they can't just walk. That probably confused a lot of people coming out here for Stampede from BC, looking for their product. But that's not what we're about.
Well, and that's what's confusing to me about why the city seems so worked up about this. You've been cooperative, you've done everything by the book, you've been open, you've met with city officials, and I get that that's a smart approach from your point. But what is it that the city's so concerned about?
I think they're concerned about stopping the BC model, and for whatever reason, that seems to infect a lot of the way we think about things. The perception and reality are two different scenarios completely. And we need to take a grasp of what reality is and start dealing with that properly. I would like to see the city make the right steps moving forward with this and following the right program with Health Canada, and not be scared, because we are helping patients. I'm a little fearful that we're going to start regulating even the services that we do, or even dispensaries in the future when they come through the proper channels, putting them out into industrial parks and that kind of stuff, when you're punitively damaging patients at this point in time that have mobility issues and can't travel through transit, et cetera, et cetera. I mean, the perception and reality are two different things.
Okay. How should the city go forward then? What business type should you be compared to at 420 Clinic?
Well, when first going through this process, it felt like a coin toss. So they deem us as a medical clinic, but I think we're closely related to more of a pharmacy, where a pharmacist does give recommendations with regards to usage, that kind of stuff. And they have retail, which is exactly what we have. So we don't dispense like a pharmacy, but I'd say we closely model that. And I don't know why we wouldn't be retail anywhere else.
Well, does it sort of muddy the waters a little bit that you've got a massage therapist in there?
No, the massage therapist is here for chronic pain, that kind of stuff. No, I don't think it massage, because massage therapists are actually considered retail also.
So is that something people would pay out of pocket for then? Like, are you billing the healthcare system in any way?
No.
Okay.
No.
And then what are the retail products that you sell?
Our retail products are hemp-infused beauty products, that kind of stuff. We do sell vaporizers, which is recommended through Health Canada. It helps regulate the patient's dosage, that kind of stuff. So we have, massage things, a variety of different alternative health products for sure.
So is the problem then that there's a vacuum here, a policy vacuum that has to be drawn by the city and presumably has to be agreeable to, or you'd like it to be agreeable to you as a business owner?
Well, of course I would, but honestly, I still think it's not as much a vacuum as it is perception and reality that seems to be a problem. When they start talking about things like, negatively impacting the communities that operate with our marketing techniques with the use of a marijuana leaf, I mean, that's just, you're starting to get ridiculous at this point in time. I don't have, a zombie marijuana apocalypse happening outside the store because we have a marijuana leaf symbol on our sign. It's just not happening. And the medical and pharmacy symbols have snakes on it, and people aren't scared to go in there. They're scared of snakes. So I just don't understand what this perception and reality. I mean, unless they're punitively damaging patients, as far as I can see, with these misconceptions. That's all that's really happening. And we just need to get a grasp of reality and what the real laws are, and start working in the proper steps.
Yeah.
And there are proper steps. So we just need to start taking them.
Well, let's think. Look, and I get that the city is worried that we're going to end up in a situation like Vancouver and face that dilemma, but we're not there yet. I mean, until a dispensary opens, we don't have dispensaries. Just because you exist doesn't mean that we're necessarily any closer to having dispensaries. Exactly, and dispensaries are illegal, plain and simple. They are illegal, and we're not for dispensaries until we start seeing them coming through a licensed producer, and we work with licensed producer to act as a dispensary. Because otherwise we have no idea where that product's coming from. And in all these people coming from BC that go to dispensaries, they still have no idea where their product's grown. They don't know if it's clean. They don't know exactly what's in their product, and it's not good for patients. It doesn't fit our model at all.
So, Jeff, I haven't been down 9th Avenue in Inglewood in a few days, and I don't recall seeing too many like bong shops or head shops on that drive. Are there?
No, there's a lot of vape stores.
Okay, interesting. Because you said something about the marijuana leaf on the signage and that you might be getting some grief for that. It leads me to believe then that the city, it's not so much the city as it is the Inglewood Community Association and the BRZ.
Well, they seem to be behind now. I mean, it's one thing before we opened, like everyone thought they didn't know exactly what we were going to be, and now that we've opened, the community support and the BRZ and everything has been very good to us. They're seeing what we actually are. We're here and we have patients. We don't have a drug problem outside of our area.
But how are you making money then? Are you making money off the patients?
Yeah, hopefully they buy a vaporizer, a retail section, a registered massage therapist.
Okay, but if I come to you, the stuff you sell, but if I come to you and say, Jeff, I think medical marijuana would treat me for what I'm dealing with, in terms then of getting that advice about strains and which doctors to go to, that's a free service?
Yes.
And do you get a kickback?
It is with us. It isn't with everybody, but it is with us.
Do you get a kickback from a company like Tilray, for example, if you hook a patient up with some of their product?
No, they don't do what you call kickbacks, if that's what you're thinking. They help with education services. They're going to start putting some panels up in here to discuss and their resources, that kind of stuff, but there isn't the kickback that you're talking about.
Then is your business model, though, like, how does it develop to the point where you make more money? Could you ever be selling medical marijuana in your business, as far as you're concerned?
Well, not in this specific location that we're in now, but eventually, yes, this is going to happen. There's no doubt about it.
Okay.
And medical dispensaries are going to be happening. It'd be no different than Molson, Labatt selling to your liquor store.
Okay.
Eventually, we'll be the first day liquor store, but it'll be coming from a licensed producer. And that's important because it's important for patients to know exactly what they're getting.
So, okay, Jeff, before we let you go then, I mean, Sounds like things are good. We were hopeful when we had you on the first time, and now you're telling me that things are strong. The Community Association, the BRZ, they're all behind you. So what do you want the city to do? What do you want them to acknowledge, and what steps should they take going forward?
I'd like them to go through and take the problem.
Oh, no.
Without the fear.
Sorry, you know what, Jeff? Say it again because your phone cracked up on us there.
Oh, sorry.
No.
I'd like to just, the reality of the situation here and not let fear, like I've said before, punitively damage patients. I think we have the right steps in front of us. We just have to take them. We just need to take a step. That's all, just a step. And it's not a scary step, and it hasn't started any kind of, riots here in Inglewood. Nobody's freaking out. Unless we're against cancer patients, I don't see what the problem is here.
No, exactly. Jeff, appreciate you coming on with us here today. Thanks for this.
Hey, thank you.
All right, Jeff Moy with the 420 Clinic in Inglewood. We shouldn't need to talk about this, right? This should just be a non-issue. Jeff opens up. They've got their patients, people who use this clinic. That's it. I mean, the reason we've been talking about this, I think there was the fact that they were new in the first offering this. But really, it's about the fact that there are some on city council who seem so threatened by this. And now that this clinic has proven to be popular, it somehow presents now a new dilemma for the city. But I don't see any reason why it should.
Let's take a quick pause here. We'll come back with more. It's Kincaid and Breckenridge on News Talk 770. All right, welcome back. Kincaid and Breckenridge Show. The message I got out of Jeff Moy from the 420 Clinic in Inglewood was people aren't really clear on what's going on down at his clinic, and that he would like the city councilors to come and really just have a look and say, hey, yeah, maybe this is nothing more than a retail outlet where people get good advice on stuff.
Well, I think doctors are, in a lot of cases, hesitant to prescribe medical marijuana. Just, the uncertainty of the whole realm. And so, patients might be left in the lurch because there might be people for whom it would benefit. And if their own doctors are afraid to even bring it up, where can they go to get some clarity on those questions? Now, obviously, the 420 Clinic takes a more favorable view of medicinal marijuana, and I think there is some legitimate disagreement in the medical community over how beneficial it is or what conditions it might be good for. But it's a resource. That's all it is.
I got a couple issues with this. I mean, One of them is that, doctors, they don't necessarily feel like there's enough study, enough evidence out there for them to prescribe medical marijuana accurately. Like, what do you do? Like, hey, smoke 2, bats. I'm talking huge joints. Don't try and get away with a little pinner to deal with your glaucoma, So there's in prescribing it, how do you do it? And for them to have a resource that they can basically say, look, you've tried other things. If you want to try medical marijuana, I'm going to refer you to these guys. They can take the time to talk to you to make sure that you know what you're getting yourself into, right. Find the right stuff. It makes a whole lot of sense to me in that respect. This is a city that allows homeopaths to operate or naturopaths to operate. It seems to me like they could probably look at what this guy's doing and say, well, it can't be as bad as that. So we'll regulate it in the proper way.
Well, exactly. It is, I get, a dilemma for the city, as it is for the city of Vancouver, that you would have dispensaries open that are flouting the law. And then what do you do? Because they are illegal. But then other cities have chosen to shut them down. There was one in Edmonton just a few months ago that police in Edmonton shut down because they said it's illegal to open a dispensary. So for the city of Calgary to get all bent out of shape because Jeff opens his clinic, it doesn't add up. If the city's position is that no dispensaries are going to be allowed to operate here, then make that your policy and send the police to shut them down if they open up. If you want to go Vancouver's route and say, you know what, we're going to take a different approach. We're going to regulate these. Then they can do that. But we're making an illogical jump here by the existence of Jeff's clinic. To act as though all of a sudden now we're facing a dilemma that we wouldn't otherwise face. Yeah, now the city is looking into this. They're trying to find a solution. It's kind of reassuring to hear Jeff say that the Inglewood Community Association, the BRZ, the Business Revitalization Zone, that they're all taking a favorable view of the 420 clinic being in their midst. So it is now upon the city to figure out that in this policy vacuum that they have, that the 420 clinic exists in, that they come up with some sort of a policy that makes sense, not just for the business owner, Jeff MOOJI, but also for the cancer patients, as he put it, the people that his clinic is legitimately helping. All right. Well, let's take a pause. We'll take a puff, and we'll set up our next hour for you. It's Kincaid and Breckenridge on News Talk 77.
Roger Kincaid and Rob Breckenridge.